all of us go back to this issue of supremacy in the health sector.
It's not supremacy. You are looking at it as supremacy. It's not supremacy. We are thinking
because
about
I'm
providing
asking,
the
where
best
is
service
that
for Nigerians.
middle ground
Yes.
that government will meet JOHESU,
yeah.
and you talk about, bringing together. What is it that you think, okay, now there's this strike that is 2 months old.
Okay.
What will the government do for you? It's maybe not everything,
Yeah.
but do
what
this
we are saying
and
is
then
that,
we'll
what we are saying
call
is
off the
that
strike.
let them release the circulars. 1. All the circulars we have agreed upon. That's 1. 2. Pay the 2 months arrears, okay, out of the 6 months requested, which they agreed to pay. All of us are fishing from the same water, like I told you. If I mention an MA, you say it's like rival. It's not. If you pay A, you must pay B. That's what you're saying. Pay the 2 months and put the other ones in 2015 budget. We will gladly accept that. Oh, okay. Let us see the circulars. So that whatever we are asking, we will now point circular so and so, said so and so, about my own position, about an MA. Commerce. That's what we're saying.
Okay, and as I said earlier, you've been on strike for 2 months.
Of course.
Would you expect to be paid for being away from work?
Oh, yes. I would expect to be paid. Because our strike is a legal strike. Okay? Nigeria is a member country of ILO, International Labour Organization. These are the things that are contained in Chart 67 and 78. Okay? There are certain things you, as an employer of labor, should do to your employee. And if you fail, he has a reason to protest. You understand? That's exactly what we're saying. Did you do those things we agreed upon? And I refuse to do my work.
Thank you so much for coming on the program.
You're welcome.
Thank you. Since the start of the Joint Health Sector Union strike, the federal government has maintained that it is doing its best to resolve all the issues. This much was stated by the Supervising Minister of Health, Dr. Khaliru Al-Hassan, when he met with some of the union members on his visit to Lagos late last year.
I want to assure you that I believe in teamwork. The health team is a composition of various professionals. From whatever cadre you are thinking of, it forms the health team. Even from the cleaners, the security, they are very important to us as a ministry, because without their support, we cannot be able to do our work. I want to assure you that the ministry is never against anybody. We have been engaging JOHESU from day one, and we have continued to engage JOHESU in ensuring that their legitimate rights are being addressed to. I want to assure you that now, as a new minister in the Ministry of Health, it has been my concern from day one to bring harmony to the whole sector, because I'm concerned with the various type of strikes from the doctors, from the nurses, and everybody. So it is my really intention to ensure that I brought the whole house to order, to work as one team. I want to appeal to you to be patient. Mr. President, Dr. Goodluck Ebele Jonathan is listening. We have communicated all your grievances to him. As we are talking now, a lot of things have gone since our last meeting with your leadership. I want to assure you to please come back to your work, because we need you. Nigeria needs everybody to be working. Especially you play an important role. We were together when we fought Ebola with you. Tooth and nail. Your members contributed excellently to the success we have recorded. Now, we are at crossroads, because we need you. If you are not there, a lot of things could happen. I want to assure you that I've listened to you, and we have been listening to you, and we promise you we will get to the logical conclusion. But we want you to come back to your work so that we can protect Nigeria as a team.
Indeed, the interests of the people should be paramount in the ongoing issues surrounding this strike. We can only hope that all of these issues will be sorted out soon. In the meantime, another controversy may be brewing as the Joint Health Sector Unions and Assembly of Healthcare Professional Associations kick against the report of the Presidential Committee of Experts on Interprofessional Relationship in Public Health Sector.
Respected.
The Assembly of Healthcare Professional Associations and the Joint Health Sector Unions have outrightly rejected the report of the Yayali Ahmed Presidential Committee of Experts on Professional Relationship in the Public Health Sector. The report, among other things, addressed issues relating to the establishment of the Office of Chief Medical Advisor to Mr. President, the creation of a National Healthcare Commission to replace professional regulatory agencies and regulate tertiary health facilities, and the headship of teaching hospitals. The unions, in a press statement, described the report as biased and one-sided, saying it only seeks to further marginalize members of the unions and make them subservient to their contemporaries in medicine, demanding that the report be withdrawn for public good and the future of the health sector. Moving on to other parts of Africa, a trial of a potential drug to treat Ebola is ongoing at the Medicine Sans Frontières Center in Liberia. The antiviral Brincidofovir is being tested on Ebola patients on a voluntary basis. People who do not consent to it receive standard care. Oxford University scientists leading the research say initial results are expected in the next few months. A study involving a similar drug, favipiravir, began in Guinea in December last year. Scientists at Oxford say Brincidofovir was chosen because it is effective against Ebola-infected cells in laboratories and has been deemed safe in more than 1,000 patients in trials against other viruses, and it can be given conveniently as a tablet. While a handful of experimental drugs, including Brincidofovir and favipiravir, have been given on an ad hoc, compassionate basis in the last year, none has yet been proven to work against the virus in scientific human trials. A huge international effort involving the World Health Organization, MSF, drug companies, the Wellcome Trust and other global health organizations aims to fast-track treatments that have been identified as potential options. More than 8,000 people have died from Ebola during this outbreak, the majority in the worst affected countries of Guinea, Sierra Leone and Liberia. Researchers aim to recruit more than 100 people and will compare death rates at the center before and after the trial. Also, trials involving 3 separate vaccines designed to prevent people from getting the disease are taking place in Switzerland, UK, US and Mali. But while a number of different pharmaceutical attempts are being made to tackle this virus, experts say other strategies, including early and adequate hydration and nutrition, are extremely important. Finally, on the news segment, what appears like good news is coming from the United States of America, as new antibiotics have been discovered by U.S. scientists from a novel method of growing bacteria, a discovery labeled game changer for medicine. The researchers at the Northeastern University of Boston, Massachusetts, turned to the source of nearly all antibiotics, the soil. The team created what could be described as a subterranean hotel for bacteria. One bacterium was placed in each room and the whole device was buried in soil. This allowed the unique chemistry of soil to permeate the room but kept the bacteria in place for study. Chemicals produced by the microbes were dug up and then tested for antimicrobial properties. The lead scientist, Professor Kim Lewis, said so far 25 new antibiotics have been discovered using this method, and Teixobactin is the latest and most promising one, although the antibiotic has not been tested in humans. The last new class of antibiotics that made it to clinic was discovered nearly 3 decades ago. The heyday of antibiotic discovery was in the 1950s and 60s, but nothing found since 1987 has made it into doctors' hands. As we wind down, our nutrition tips for you today is on the health benefits of eating vegetables. Vegetables are one of the best sources of vitamins, minerals, and disease-fighting phytochemicals you can find, which makes them excellent food. One of the great things about eating vegetables daily is that they provide you with an array of nutrients, including the B vitamins, folate, riboflavin, niacin, and countless other phytonutrients. Pumpkin leaves, okra, carrot, tomatoes, cucumber, celery, spinach, and potatoes are some of the vegetables you can find around. The nutrients in vegetables are vital for health and maintenance of your body, and they are some of the healthiest food you can eat. How about making sure you have one form of vegetable in your diet daily? Remember, people who eat vegetables as part of their daily diet have a reduced risk of many chronic diseases. Keep in mind that starchy vegetables like corn, peas, potatoes contain more calories than water-rich non-starchy vegetables such as avocado, cabbage, and lettuce. And that's a wrap on Health News. Let's know what you think. Do send your thoughts to any of our feedback platforms. Thank you so much for watching. I'm Yomi Otaigbe.